And good evening and welcome to the College of Health Sciences live chat event. We are excited to have you with us this evening, and we are going to give you a brief overview of our academic programs along with our curriculum, and you'll hear testimonials from our students who are with us this evening, and we're glad to have them tonight. We'll conclude with some special information about the College of Health Sciences. So feel free to ask questions as we move through this evening's live chat event, and we'll be sure to address those questions on air. Any questions that you do not get answered on air will be answered in a chat feature later on. Now that I've covered the logistics for this evening, we will have our guests introduce themselves. This is Dr. Casey Shaddix as my co-MC.
Casey Shaddix, Director of Advising in the College of Health Sciences.
My name is Toya Walker. I'm a human health science major, psychology minor.
My name is Emily Apple. I am also a human health sciences major, psychology minor from Cincinnati, Ohio.
And then I'm Savannah. I'm a junior, and I'm also a human health sciences major.
Awesome. I'm going to give a little overview of the academic programs that we offer in the College of Health Sciences. We offer a lot of different pathways into health professions, and our dean affectionately likes to say that our college is the gateway to the health professions. We have 5 undergraduate major or program options in our college. The 3 students that are with us tonight are human health sciences majors, and that has a variety of pre-professional tracks. And if y'all want to share about the tracks that you're on and other tracks in the program, how you feel like it is preparing you to become a healthcare provider?
Yeah. So I can start. The track I'm on is physical therapy, so I want to be a physical therapist. But as far as what this major has prepared me for in becoming a physical therapist is definitely giving me a kind of perspective into the whole healthcare side of PT. Because you can kind of major in anything to become a physical therapist or to go to PT school. A lot of people do biology or kinesiology, but I felt like this major definitely put an emphasis on more of the interprofessional work that you do as a physical therapist. You know, you gotta work with the doctor, maybe the nursing home if you're sending someone there. So I feel like that aspect, the interprofessional part, has kind of helped me the most.
Mm-hmm. For me, I am actually pre-PA, was pre-PT. And one thing that I really love about this human health science as a major is that it shows you all the different tracks of healthcare, or a lot of the majority of them, and also incorporates shadowing into your curriculum. So that way, even if you go in strong, like, oh, I'm going to be this, you'll see the interprofessionalism of the healthcare field and be able to transition and see, oh, this may be a better fit for me.
For me, I'm pre-PA, as Toya said, physician assistant. So I think the most important part for me was learning about the healthcare system, like they said, and also shadowing. But I noticed something that I'm taking away this year is that you get to learn about what's going on in the healthcare system, because when I first decided to come to college and actually decided to do pre-PA, I didn't think about the actual healthcare system and how that relates to ethics and law and things like that. And I think with this major, you get to learn that a lot. And also you're getting the opportunity to shadow, like they said, just things I didn't think that I would be able to do when I was coming to the school, research, and lots of opportunities that they offer.
Those are all really good points. I think one of the highlights of being a student in our College of Health Sciences is how you can really engage with the medical part of campus, and the fact that we have our medical campus and our professional school programs right here on campus. You're not having to travel to a different location, or we're one of 8 universities in the United States that offers such a large number of professional and academic colleges on one single campus where you're not having to travel. Did y'all think about that at all whenever you were searching for universities?
Well, I know that when I came in on a pre-physical therapy track, I noticed that there was just a whole bunch of healthcare happening at UK's campus. I know I wanted to stay in Kentucky, and I knew that UK was probably going to be the best bet if I wanted to go into the healthcare field. I actually chose HHS because it houses the PT school. And so I figured as much of, oh, okay, if this major is also part of the College of Health Science, which also houses the PT school, maybe I can get to understand it a little bit more and understand like the profession that I was choosing at the time.
Yeah. I was on almost the same track. I was kind of more in the mode of I knew I wanted to do PT school, and I knew I wanted to do PT most likely at UK. So it was what was the direct line to that program. And to me, that was the College of Health Sciences, Human Health Sciences. But when you're in the program and you actually take time to notice, wait, we're right next to the hospital. We're connected to the people that we're going to be shadowing and working with one day, and the facilities where we may one day be that are serving this area of Kentucky. I think it has added value that I didn't notice before.
I think for me, when I was applying to colleges, because I'm from Illinois, and I knew I wanted to do healthcare, but one thing that I looked for was they had hospitals and medical care and access at their fingertips on their campus, and I noticed that UK was one of, I think, 8, or I don't know the exact number, I think one of 8 that actually has that. So I applied there and a couple other places, but when I got here, I just saw the closeness that the entire campus has, and not even the campus, more of our college too. I saw more of that closeness when I got to visit our college and see just how the students interacted, whether they were in undergrad or they were in PA school or PT school, and just how they even interacted with the undergrad students as well.
And another program that you all have a lot of courses with is our Clinical Leadership and Management program. Clinical Leadership and Management is intended to help students to become healthcare administrators and work in those administrative settings in healthcare. And they have about 400 hours of practical experience that they have to complete as a part of their program. So they're also becoming engaged and exposed in the administrative settings and really helping to build their skills in a variety of ways. What are some of the courses where you feel like you've had an interesting engagement with clinical leadership or students and sort of that perspective that they have?
One of the courses that honestly is my favorite, I tell people this, was CLM, or Clinical Leadership and Management 350. So it's Healthcare Politics and Policy. And this class, I think, opened my eyes a lot. Just seeing the problems in our healthcare system about healthcare insurance and who has access and who doesn't, and learning if healthcare, is a right or a privilege, and seeing people's views on that and getting to hear from their perspectives and see what they thought on that. And that's just something, like I said earlier, didn't really think about coming into college. So that was really interesting to see. And also, one of my friends, I think they also have so many opportunities just to interact with people in the administration, side of things. For instance, one of my friends, she actually got partnered with a healthcare administrator at the nursing home that I worked with, and I remember seeing her. I was like, what? That's one of my classmates, and I was like, oh yeah, how did you know? How are you working here? But just seeing small things like that for the CLM students as well.
Another program that we have is our Communication Sciences and Disorders program. And Communication Sciences and Disorders is mainly intended to train students to become speech-language pathologists or audiologists. And so it's the speech and hearing sciences and working to rehab and provide care to anyone who is working through language development concerns, or they may have a stoma implant from a laryngectomy, and so they're working to learn how to swallow again, or elder care, learning how to swallow after a stroke or something like that. And audiologists working with patients that have had profound hearing impairments or may have been born deaf and have a cochlear implant, things like that. A fantastic opportunity for students in that program is we have an academic clinic in our college. Have any of you had a chance to go through the academic clinic?
I have not. I walk by it a lot, and I see people coming in and out of it all the time, but I haven't actually been in it. I have a friend who does research with one of the clinicians in there, though.
Yeah, I have a few friends that are CSD majors in undergrad right now, and I think it's honestly so profound what they do, because you don't really understand the need for it until you actually need it. I think we just talk and we don't really have problems like that, but with the patients, when you're able to see it on that standpoint, like some people do have a problem swallowing, or some people do, you know, have a problem with talking and can't really like pronounce or say things, or they just need help in that sense. You get a whole nother perspective of healthcare that you don't really see a lot.
Yeah, I think one of the things about being immersed in that healthcare setting is it's made me really mindful of ability and like being grateful for your health, because we see it all the time,
Yep,
you know, with the
exactly.
patients and the families, and even just the education that you all are receiving. Like, I'm very grateful for the kind of healthcare I receive. And another major that we have is medical laboratory sciences. Medical laboratory sciences is intended to train students in clinical pathology. So they do really cool and interesting work because they test human fluids and tissues for diagnostics and prognosis. So anytime you've had someone who, have y'all ever had like a throat swab, those sorts of things? You know, so when they send things off to the lab, the medical laboratory scientists are the ones that are testing those fluids and tissues. They'll do blood tests, they'll do urinalysis, they'll do microbiology tests. So if you've had a biopsy and they're testing that to see if something is malignant or benign, and then they'll work with healthcare providers to help update them and help them diagnose and provide prognosis to their patients. Have y'all been up to the labs before? I know we have the simulation labs on the 4th floor.
I have not.
I've seen it. I remember you took us on a tour one time and we saw the labs. I thought that was really cool. I think it's easy to, when you come into college and you say, oh, I want to be a healthcare provider, you think or forget about the importance of needing the labs and the people behind that. So I think it was really cool to see like our program has that to offer for, don't we have graduate school as well? Undergrad and graduate school, and also the labs that they have to offer.
I've always heard for MLS also, it's really good if you like kind of like chemistry lab. If you think about that, whether you're in high school now or college chemistry labs, it's literally the procedure, the experiment, the test tubes, all that stuff. If you like that, that's kind of a good fit.
Yeah, there's a lot of technology in medical laboratory science too.
Yeah.
So they're running these big analyzers and sort of troubleshooting if you're doing hematology testing and one of the analyzers goes down, you have to troubleshoot that technology. So at least having a curiosity and that love for science and technology and the impact that it has in healthcare, I think is really important.
I think there's a lot of beauties of being in the College of Health Sciences when we're talking about all of these majors, and really the interprofessional nature of what we have to offer, and that we house so many different areas of healthcare and bring them into one so that students can gain insights from a broad array of healthcare professions and not just the singular one that maybe they're focused on at a given point in time. I think another way in which we help expose students is through some of the research opportunities that we have, and that we house the only undergraduate research certificate on campus. And I think that is a beautiful program for students to be able to get connected to research and understand what goes into the science behind that which we practice in clinical settings. So I don't know if any of you all want to talk about your experience with research.
I can say a little bit. I did some research. It was one semester, I think spring my sophomore year, helping a graduate candidate, I guess you would say, of a PhD in the rehabilitation sciences program. And she was working on improving mobility and retention rates in hospitals in hospital patients. And what I did for her was transcribing these interviews she had done, and it felt like it wasn't really that, researchy, but through that process you get to learn of how important things like that are in the whole process, and you build relationships and you get connections to more research, and it turns into letter of recommendations, which is really good. So
With me, my freshman year, I did a research for the summer where I was in a peds NICU and I was looking at PT as well. What they were studying was how we worked with not only just physical therapists, but alongside with speech therapists as well, and was kind of studying how the growth of babies that were born in post-NICU or born in NICU, and how they kind of like grow with learning, and how if there's any difference between a baby that's born in the NICU or a baby that's not born in the NICU. And then recently I just started doing a research that focuses on the healthcare disparities among African American women in low income living, and how that affects their cardiovascular health, because African American women actually have one of the lowest outcomes when it comes to cardiovascular health. One thing that I really like about UK is that they have research that widely ranges, and you can choose something that completely fits you. So when you think about research, it doesn't always have to be something that with really long words in a lab with microorganisms that you can't pronounce. Like, it can be something that's very much more like public health, if that's where you want to go with, or more like social health, social sciences, even psychology wise as well. So getting involved in research is such an amazing opportunity. And even with me going from PT now to PA, I found a research that aided with me when it came to PT, but now that I've switched into more of understanding that disparities, and it's more interprofessional as well, I was able to find a research that gained more into what I was interested in.
For me, when honestly my sophomore year, I heard about the research opportunities that we had, and I thought to myself that it was not for me, because I love chemistry and science, but I didn't think that I would love the lab aspect of it. But I decided to try it out because honestly we have so many opportunities, and I thought that was amazing to get to work with a post-grad or somebody who's in graduate school. I thought that was just really amazing. So I got involved my sophomore year at the Center for Muscle Biology, and I work with a post-grad or a postdoctorate scholar actually, and we're working with mice and muscles in mice, and we got to see the growth in that and how that relates to exercise in humans. And I loved it last year, and I love it now, and I'm still working with him, and will continue until the end of my senior year, honestly. But just something that I didn't expect to love as much as I do. But yeah, I think that's really important that we have research and that we have so many opportunities for a student to try out, and you never know, like, you might honestly love it.
I think it definitely helps with that exploration of where you want to go with your future career as well, and that can make a huge difference in your lives. You know, a lot of you all started with the Living Learning Program or the Interprofessional Healthcare Residential College, which is a partnership or collaboration with 9 healthcare or related colleges on campus. And so could some of you all talk about that LLP, Living Learning Experience, and how that benefited you in terms of being immersed not only in a healthcare-oriented living experience, but also in connection with people across the university?
Yeah. For me, it was really beneficial. I honestly I had kind of a hard time adjusting just coming from so far away, about a 7-hour drive. So I thought, coming from, Illinois, I'm not going to have that many friends or people that are in my major. But joining the LLP, I had tons of people. Everybody there was in a healthcare major, and the peer mentors there, they had taken those classes that you had taken, and they just have been in your shoes, and also with the RAs there. So I found that really helpful. Whenever I had homework or had just things to work on that I didn't understand, they were there to help, and also with your classmates who were going through the same exact process as you were, worrying about if they were on the right track, or just anything healthcare related that you might want. They also had a lot of programs that they offered, and they'd have professors come in that were in your classes, and just a small environment for you to get to know your professors and your classmates, which I thought was really amazing. Just that small hometown feel, like I was mentioning earlier. I think that was really beneficial to me, and also just getting to meet so many people who are driven and really excited about the healthcare field. I actually met some of my best friends, and we're still roommates to this day, actually.
With me, I think Savannah made such a great point when it comes to the fact that you're surrounded by people who are in the same classes as you. So when I was in the LLP, I vaguely remember just freaking out over Chem 105 because it's a class that's pretty hard. I don't really like chemistry that much. And just being able to run outside or into a study room and just be like, who's taking Chem 105 that can help me? Having like that type of environment around you is so beneficial, as well as the LLP also offers programs when it comes to service and offers networking programs. So when I did that research with physical therapy my freshman year, it's because I went to a networking dinner that was held by the LLP, where I was able to meet the person that was over that research. So it helps a lot when you want to get your feet wet a little bit and kind of dabble into some service and learning how to navigate college, and also getting your feet wet when it comes to where you want to go with your future career.
Y'all make some really good points about the connections with people, and I think the fact that the Living Learning Program, the Interprofessional Healthcare Residential College, and the College of Health Sciences cohorts a lot of our courses, and we make them health related. And I've written recommendations for students that we've taught in the first year who are applying for research experiences at Vanderbilt over the summer, or they're wanting to take on a leadership role on campus and they need a reference. And so it's really nice to build those connections and sort of a sense of community, not only with your peers but also with the faculty and staff.
What I was going to add to the IROC discussion is I actually wasn't in the LLP. I still lived in the dorms on campus, but I wasn't in any specific group. But I think I was still able to find the qualities that they're talking about that the LLP had just within our college. So you talk about connections and community and feeling supported and finding help for classes. And the college provides advisors that are available all the time for you to talk to them, no matter what you're dealing with. We have peer tutors, like I'm a tutor for physics for our college, so you can work with them if you're struggling in classes. And then just the cohort idea too. You're in the same class with, 100 for the cohort?
For human health sciences, it's a cohort of 105.
Of 105, okay. When I started it was 75, but same thing, small, right? Small, and you go through the 4 years in the same classes with them, and you become very, very close friends.
I think that connectivity that you're also talking about, whether you got it through programs or through the special things that you're doing in the college, and getting that access to faculty members who are also connected to the field. Can you all talk about some of your experiences with some of our faculty within the College of Health Sciences?
Something I noticed, I actually ran into one of our faculty members at a coffee shop one day, and I didn't know that she even worked within the College of Health Sciences. And I met her, and we just got to talking, and she said, "Oh, I work in the College of Health Sciences." I was like, "What?" Like, I'm a human health sciences major, and so that got us connected. And now she actually does media for ambassadors and for the college. And I think just everybody's really close, and getting to talk to your professors after class, and just whenever you see them about, whether it's on campus or out and about, just everybody saying hi, and they know about your life and what's going on. It's really easy to keep connected with those people.
I think that getting in touch with faculty members in the College of Health Sciences is just so easy, and it's just so fun. And they're all just excited to talk to you. Like, I go and visit quite a few faculty members just on my way to class. I'll just stop by, poke my head in their office, and say, "Hey, how are you doing?" I met the lady that's over my research. Her name is Dr. White. I actually met her just at, I think it was an ambassador event where we were just kind of serving food, and we just ended up talking, and now I go visit her all the time, and she offered me to help on her research. So I think it's a lot about not only just like connecting with people to connect with people, but also developing a solid relationship with people. Like just going in and saying hi and connecting on a deeper level than just, oh, this person could eventually write me a letter of recommendation. Like, it's about developing a really strong relationship with someone that understands who you are as a person and understand where you want to go, and you're able to bond on that.
I would say one of the most impactful experiences I have had with a faculty member was that one of them is helping me do my own research right now. So I'm doing my own research study right now on error disclosure in PA and PT students. So when they go out on like their clinical rotations and everything, errors happen, unfortunately. So do these students know when to recognize it, to manage it, and report it? Do they feel adequately prepared to do that? So this faculty member actually gave me the idea for this and kind of helped me develop it when I was very interested in the topic but didn't really know how to make it become reality. So she was a really good mentor for me in that whole process, and now our study's completed. So it's exciting. Yeah.
Yeah, that's awesome.
I think something that stuck out to me was the academic advising model that we have. We're required to meet with our advisors 3 times a semester. And when I first heard about that, I saw that was different than other colleges. But I think that helps build a relationship definitely, because the offices within the Office of Student Affairs are always open. The doors are always open. You walk in, you can just plop your book bag down if they're not busy and say, hi, like, this is what's going on with me today. If you need any help with anything, like I said earlier, they know your situation, they know your story, where you're from. It's easy, like Toya said, to make a connection.
Yeah. Our team of advisors and all of our staff in the College of Health Sciences are really helpful and highly trained in a variety of areas. And we have a student success series that we offer each semester that I know a lot of you have been to programs in. Some of them are academic minded, so I've led sessions and workshops on curbing your exam anxiety, or something financial, like we have a student success and financial wellness coordinator, Rebecca, who helps with debt management and knowing what a credit history is and why is that important when it comes to taking out student loans. What does that mean for me? And then we even do a lot of fun service activities. So we'll make tie blankets for the Children's Hospital, or Veterans Day cards from scratch for the VA Med Center, a lot of different things like that.
And I also feel like being part of like the ambassadors, we've been able to do a lot of things just for the students as well. Like we'll plan days where we bring out the service dogs, which is really fun, and just to be like a stress relief for the students whenever they're going through like all the exams and the stress of college. So I think it's really awesome.
Yeah, I think one of the other neat things, right, is that all of the professional organizations that are connected to the healthcare areas, which you have immediate access to. So you all have talked a little bit about pre-PT club and then the pre-PA club, and but there's also a pre-medical laboratory science club, as well as NISHLA for the communication sciences and disorders students. And so there's ways to get connected beyond the classroom, but still connected to the classroom, and still develop relationships with those who are going into similar professions as yourselves, and also other professions within the college.
Yeah, I think one of the great things that the Medical Laboratory Science Club does is a lot of people don't know what a medical laboratory scientist is, and so in a lot of cases they're doing outreach in schools and in the community, so they can help to provide some health literacy to patients in the local community, but also just explain who they are so we can all have some gratitude for the impact that they have on our healthcare.
I think the other piece that stands out for me in terms of the things that our students can get connected to is that we have a huge commitment to service. And I think that service happens in a variety of ways, somewhat through our organizations, but it's also connected to service in the community. So our physical therapy program is connected to a program that they started, Samaritan's Touch, which allows both our students at the professional level as well as the undergraduate level to do some shadowing and get some hands-on opportunities with people within the community, and to continue our service and outreach. But the other place that I think that we are expanding our repertoire is within education abroad. Students at the undergraduate level can get connected, whether that's through our experiences. We have a few opportunities this summer connected to Great Britain, as well as to studying in London proper, as well as we have another program that our students can take advantage of that's in Paris, France. And each of those is also a mechanism for expanding the overall repertoire of understanding of healthcare in other countries, and how does that compare to the U.S. healthcare system. Beyond that, if students come into our graduate and professional programs, they also have clerkships and clinical experiences that they can take advantage of abroad. And I think meeting that outreach to both national and international to expand our own base of knowledge, but also to understand and become more culturally humble, and meeting that service piece, I think is really helpful to rounding out the student experience. So I don't know if any of you all have had friends, or if you've taken advantage of some of those experiences you might want to talk about.
I actually didn't do education abroad, but I did a different program called National Student Exchange, where I actually exchanged to California for a year. I think that we often look at different countries, and there's a different culture between the United States and different countries, but there's also such a different culture between Kentucky and California and Texas and Washington. Every state has their own demographic, their own vibe, the things that they do that is just a little different, and it's beautiful at the same time. And I just loved being in California. I went to a school that was majority Hispanic, and I was immerged in Hispanic culture in Southern California, and it was the greatest experience just to be surrounded by people that were different than me and understand what they're going through, and being able to pull that back into a medicine perspective, to know that your patients are going to be coming from a variety of different backgrounds, and how are you able to handle being culturally competent when it comes to that. Even through that experience, I was able to do service opportunities in Nepal, which opened my eyes even more to the fact that there's places that don't have clean water, and that genuinely need people to pursue not just medicine but all these different fields as well: PA, PT, medical, lab sciences, clinical leadership and management. They need students like us to pursue it and to understand where they're coming from as a society as well.
Such a good answer. I have never studied abroad myself, but my roommate has several times. And the experience she had actually wasn't extremely positive. There were a lot of positive things she got from it, but there was a lot of learning she got from it also that I feel is applicable to many people. Basically, the group of students she went with, she just didn't click with. They didn't have a great time, didn't really get along together. But from that, she kind of drew that, sometimes you're going to be in really uncomfortable situations, maybe in a place where you've never been before, and that can be scary, but knowing what is around you and appreciating, what you have, and knowing your strengths and how to have perseverance through that, I think are some of the most important things she's learned from it.
I personally haven't studied abroad, but I'm currently working on it for the summer, actually. But that's something that I noticed with our college and our clubs that we have here. Through the pre-PA club, they have a trip that goes to Mexico every spring break. And also through the pre-PA club, they have an organization that an actual PA student that went here started in Africa. And she has students come out, whether in undergrad or they have their clinical rotations there. There's just lots of opportunities within the college to go abroad as well.
Yeah, there's a commitment to the Shoulder to Shoulder program, and those students travel to Ecuador a couple of times a year and work on an interprofessional medical brigade to service individuals from that region. The other piece of that puzzle that I think is really important is in respect to a rural education initiative, and that we have multiple campuses, and that those campuses are also not just in Lexington proper, but are also in Moorhead as well as in Hazard. Our medical laboratory science program for students at the undergraduate level who would like to stay connected to their rural community can actually get their undergraduate education in Hazard. And I think that's a really phenomenal opportunity for students, and to remember that we are trying to educate professionals to go back and serve in underserved areas.
Yeah, I think the fact that our students are so highly trained and highly skilled in a variety of areas is something that makes you uniquely competitive when you apply to different programs. And I know Savannah and Toya, y'all haven't quite got to that stage, but I know Emily has been admitted to physical therapy school and has navigated the process. So
Yes.
how did you work and then how are Toya and Savannah, how are you all working to be competitive to get that admission longer term?
For my admission process, I found the most important thing just to be like we're doing right now, talking about my experiences and finding ways to articulate those, because it can be easy to go through college and just, oh, I'm a part of this club, I did this trip, I did this thing. But if you don't reflect on that and think about, okay, how is this making me better to serve people in the future, or to be better for my community, or to help me better figure out health disparities, what did I learn from it, then it doesn't have much value. So that was the most important thing for me, was reflecting on especially my experience within our college and how that's helped me. That was the biggest thing I talked about in interviews, was in some of the things built into our classes, like the service projects and shadowing opportunities. Reflecting on experiences was probably the biggest thing for me.
Things that y'all are thinking about?
I think with me, since I'm the one that has switched from what I came into in the beginning, I think it's a process. And it's okay if you don't know, like, what it is at the moment. Because as you take these classes, you begin to learn more about yourself and what route you want to go. So for example, I took a health policy class where I began to learn more about disparities and more about equal rights when it comes to healthcare, when it comes to health literacy. And that class just enlightened me. And I was like, I want to do something more with this. I want to do something more that can aid a community that generally doesn't feel like they're being aided at all. And that was what drove me to make a change with what I wanted to do, because I realized that I wanted to be focused on something a little bit more different. And so I think with me, when it comes to the whole application process, it's choosing something that you have a passion about. I know I have a passion for people. I know I have a passion for helping people. And I know that I have a passion to wanting to see a whole community change. And using that passion to pursue what you want to go, like, where you want to go, it always will help you get to where you want to be. People see passion. And so I think that's my biggest advice is, don't just do things to put it on an application, but do things because you generally like it, you're generally passionate about it, and it shows.
Mm-hmm. Yeah, that's good. I think for me, the same, honestly, is passion. I think coming into healthcare, you think, oh, I need to be doing this, this, and this, and think of it kind of as a checklist. But I quickly found out that, like, freshman year, that is not the way to go. You will get burnt out, and it's not fun to do something that you don't enjoy, honestly. So I think for me, just starting out with what I was passionate about, there's a big faith component to what I do. So I got involved with Christian Student Fellowship, and so I thought, okay, how can I faithfully serve others around me? And I got into serving throughout that community and getting to go out into the Lexington community through that. So I think that was important for me. And I think getting ready for applications and things, it's really helped with, like I said, the closeness. I always talk about that, but it's so important. I think getting to interact with current PA students on our campus and also current PAs, like through shadowing, asking them what they did, what their process looked like, how they navigated through different applications in different schools. I mean, just getting that other feedback, I think was really helpful as well.
Yeah, y'all had some really good points about how there's no sort of perfect pathway or golden ticket checklist that you're looking for. And I'm sure you all, you were in that mindset at one point where it was like, give me the checklist. What do I need to be competitive? How do I get to my next step? And there isn't a perfect pathway, but I call it the toolkit. I know you've all heard that before, of skills and knowledge that you get to decide what you're going to put on that plate and how it's going to go.
And I think fit is really, really important. And I think when you talk about passion, for me, that also lends itself well to fit, because if you're not feeling like you belong someplace, it's not going to be the best experience for you. So if you're in it for the checklist, that's probably not the right reason for choosing the major that you're going to choose. It really should feel like something that you can be passionate about, that you can find happiness and security in on sort of a daily basis, because Toya came out of a Physics 2 exam and this evening, and it's, there are going to be challenging moments through your healthcare related careers and majors and in the classes that you're going to take. And so if you're not finding your passion at the end of the day, it's probably best to try to figure out where that is, part of your exploration and part of that process. And so I think that's the other thing about the College of Health Sciences, is that we're really helping you explore that fit and find that right place for you at the end of the day. But what that brings up is a question for me, for all of you all, is when you look back at, some of these students out here are exploring their options and thinking about where they want to be for the next 4 years of their life. What are the things you wish you had known prior to coming to the university that now you know today, but you'd like to tell others about now so they could use it as a mechanism for helping find a better fit for themselves?
I think I would say that it's okay to be in a vulnerable situation. I feel like that's definitely something coming into college I never thought about. I was always, oh, I need to be competing with everyone. I need to be on the top of my game all the time. I don't need help. I can do it. But sometimes you're going to come to a point where it's okay to realize that you need to lean on other people. And that's a great thing, too, because you can, rely on your community that is there for you, especially in our college. I think for me, this came with some of my classes that were really difficult. And I thought I could handle them, but they got really hard. And so I went to tutoring, and it honestly was the best decision in helping me succeed in those classes, and for me learning that it's okay to be in an uncomfortable situation you've never been before, but just to recognize it, take hold of it, and find the resources that can help you with it.
I think with me, it's okay if you fail a few times. I think everything is a learning process, and you're not always going to get an A on the exam, but it all depends on the effort that you put in. So if you know that you're putting in your best effort into something, it's okay if maybe it wasn't what you exactly wanted it to be. I know that there was countless times that I probably went into like a chem exam or a physics exam, and I was like, I studied for this, and I genuinely have no clue what's going on. And that's completely fine. As long as like you're trying your best to understand the information and you're trying your best to get towards your goal, it's okay if it's not always what it looks like, what you think it's supposed to look like.
Yeah. I think for me, coming in, especially freshman year, like we were talking about earlier, the checklist, I was like, okay, I know I need to do this, this, and this. And there was also a lot of comparison. I think that's really hard freshman year coming in. Seeing what everybody else has already done. They've already done all of this shadowing, all of this, like working in the healthcare field. They already know, they've known what they wanted to do since they were 5 years old. I think that's hard seeing that when you're coming in, but then realizing that honestly, like it's a different process for everyone. It looks different for everyone. You could not start shadowing until your sophomore year and you'd still be fine. Whatever path you decide to take, how you decide to take it, you'll get there, and you don't have to look. It doesn't have to look the same as everyone else.
Yeah, Emily talked about how as a pre-PT student, there are students from majors all over campus, and I know y'all are in organizations where you're on the same health professions track as other students, but they're from a host of other majors, like in the Living Learning Program, the Healthcare Residential College. Students come from 9 different colleges, and so there's just so many different ways or sort of means to an end. And I think helping students understand that is important, and going online and looking at our curricula for each of the majors and looking at the course titles and seeing what you're going to spend a significant amount of your time in that 4 years learning and the topics that you're going to be covering is a key indicator for, do I want to spend my time studying these items and these topics, or would I be more interested or passionate about another area of study?
And
Go ahead.
You're good.
Okay.
But I think that Emily brought up a good point too about just leaning on people. I think that we all come in when we think about healthcare, we think super competitive. Everybody's kind of our enemy, pew pew, and but when it comes down to it, in the field, healthcare is so interprofessional. You have to know how to work with people. You have to know how to uplift your own strengths, even if you have faults, and uplift other people's strengths as well. Because at the end of the day, you guys are all working towards the same goal of taking care of your patient. So it's good to start learning that now, is that freshman year when you come in, it's not a competitive thing. You have to be able to sit down with another group of people that are going through the same classes as you, and maybe even getting a better grade, and say, I need help me so we can all get to this goal together.
I was going to talk a little bit about the Pre-Physical Therapy Club and how it's kind of been a great resource for me in that aspect of leaning on each other. And what we've kind of created or made this club to be over the past few years is, rather than just being a club that people can be a part of to put on their application, we really wanted it to be a club where students who had an interest in physical therapy could come together so that we can make each other better, more competitive, more competent applicants. So with that, we're having events where we do resume and interview workshops. We're doing service events. We're having PTs from the community come in and give us advice on their experience, just so that we can kind of make each other better. And what Casey said is that we're all different majors. People are bio majors, chem majors, kinesiology majors, human health sciences, and even more. And being able to see all of those different majors who, I don't talk to any of them on a daily basis normally, but when we come together at our club meetings, we're able to share, oh, hey, I shadowed this person the other week. Here's their contact. They'd be a really great resource for you. And we're kind of able to form our own little community.
One of the things that I think students think a lot about, or at least probably their families do, is how do I afford my education? And I think one of the pieces that we've brought together in the College of Health Sciences, and Casey mentioned this earlier, is that we do have a student success and financial wellness coordinator on hand. And part of that is to help families to figure out how to budget and think about their education, how they're going to afford those 4 years, and for their current students to figure out how they're going to afford the graduate and professional programs that they're moving into. And I see that we had a question earlier about scholarships. And we do have scholarships available in the College of Health Sciences, and you can access that through our website to learn more about those opportunities. But I think even beyond that, I think a lot of our students are able to access resources across the university as mechanisms for helping afford your education. I don't know if any of you all have had experiences in navigating those waters, but if you want to touch on that.
Mm-hmm. Oh, sure. I think something, like I said, coming in, I think students really don't think about the finances part. At least I didn't. I was like, Mom, I'm going to UK. And she said, okay, hold on. Out of state and all that. So I think that was important that UK had a lot of resources for scholarships. And that's something I noticed. And also something I noticed is that even if you come across a problem throughout your academic career, financial problem, that there are so many people there to help you. Within our college, within Funkhauser, I've had a couple problems that can arise, and just getting people on the phone and saying, okay, this is my problem, having them say, come in and we'll talk about it, and figuring out right away. So I think that's really important, and that's been really helpful throughout the years.
For me, in my experience, scholarships that were available through UK are really what opened up even the door for me to come here. I was kind of in the same boat as Savannah, where I was like, oh, I really want to go to UK, but my mom said, wait, we can't do that. But then I did some more research and found they do automatic scholarships where if you already have a certain GPA and ACT score, you can receive those scholarships whether you're in-state or out-of-state. I think they have different ones. But then they also have the competitive scholarships, and those were the ones that really even provided the opportunity for me to come here. And those scholarships, they are pretty competitive, but if you strive for it and you put in the effort, they are worth every second of your time, for sure.
And, a lot of students think, whenever you finish your high school years and you transition into university that you should stop applying for scholarships, but that's, it's a continuation. You continue to apply for scholarships, and there are deadlines throughout the year, every year. And so, I always advise students, have a goal each month, and Rebecca has a great strategy with this of, apply for $2,500 worth of funds per year, or not per year, but per month, or 2 to 3 awards per month, and sort of set a goal for yourself and continue to apply for scholarships, because they're out there all over the place, and sometimes they're health related and sometimes they're not.
And they add up too.
They definitely do. When you look at your education that you've had in the College of Health Sciences, tell us a little bit about what is the highlight for you in your education so far?
Highlight?
Yes.
I think the highlight for me is honestly just learning how to work with people even more. like, I think my main passion, if I could even list a passion with myself, is that I just love people. I love all types of people. That's why I kind of go everywhere. I'm like a butterfly. I just love people in general. I love people in different countries, people with different cultural backgrounds. It all just interests me, and I just love, especially here in the College of Health Science, I'm able to put like my love for people and healthcare into one. It's like, how can I learn how to help people from various backgrounds, the people that I love? How can I help them in a way that's so beneficial to them that it's vital? And healthcare is so vital. And I think that's one thing that I specifically really enjoy, is just learning how to be interprofessional, getting a newfounded respect for other fields as well. It's like, it's not just about the med student, it's not just about medicine, it's not just about PA, but there's a group of us that's all aiding one person, whether we know it or not. They go to PT, but they might also go to speech, but they might also go to a primary care doctor, but also maybe go to an oncologist. We're all working together for the same person. I think it's one of those things of knowing that I love.
I think for me, the highlight was actually the service project I did in Dr. Reamer's class, where I worked with a organization within Lexington in helping serve their members of the organization where they're at. I think one of the big things in healthcare is you expect everyone, or not you specifically, but it's kind of a trend for people to expect, everyone to be able to make it to the doctor's appointment at the time that's convenient for the doctor. And sometimes that's not the best solution to help someone. Maybe having a home health therapist, for example, go to them to be able to help them. Realizing that and the importance of serving people where they are in their life, in their story, has been the most impactful for me.
I think for me, I'd say it was two things. First, definitely the community that I've gained. Just starting from, like I said earlier, the LLP, I've gained some of my best friends, and just getting to be roommates with them and seeing people in my classes out and about, seeing them at coffee shops and saying, "What are you working on?" And you might not even know their name, but you know that they're in your class, and just waving and saying hi, and the kindness of everyone here. That's one of them. And also, I think has been really important, is just learning more about the healthcare system and things that I didn't know. I think that'll really help applying to schools, and also when you're actually within your career field. Like I said, knowing the cultural competence, knowing how to deal with some certain situations, knowing when it comes to healthcare insurance and what that looks like, just things I didn't expect to be learning when I came into college.
And I think as well, like just adding on to her, is that in HHS, I don't know about any of the other majors, but we actually have a communications class where we learn how to talk with patients. And I feel like that was so handy because I actually did a shadowing where I shadowed a doctor. And while the patient was talking, I just maintained eye contact with her and was nodding and listening to her. And after the appointment, she just came up and hugged me. And it was just that connection itself, just off of something simple as eye contact. And so I think it's so beneficial, like the stuff that we learn, because it does apply. Like, sometimes you take classes that you're like, this does not apply to my life whatsoever. But like these classes do. And I think that's what I enjoy so much about being an HHS major itself, is just that everything's targeted towards healthcare, health law, health politics, health ethics, communication in healthcare. Everything is just aiding you to become like the best healthcare professional you can be.
I think I can add on that also. That's been one of my favorite things as well, is kind of learning how, as a health professional, a lot of times you think of it as, oh, I'm going to go learn everything about the body, learn how to do surgery or this procedure or that procedure, but you don't really think of the people side. Some of the most impactful providers are those that keep eye contact with you or really listen to what you're saying and what your needs are and what your situation is. And through the classes that we have, I feel very well prepared to be that type of provider that serves others for what they need rather than for wanting to just simply fix them. I feel like that's a common thought in medicine, is we just want to treat, but sometimes it's better to just look at your patient and listen to them and say, okay, what's the big situation here? How can we best serve you?
Mm-hmm.
And I think that part of what you're talking about in servicing the patient and bringing together our different undergraduate majors.
Yeah.
So we have students who are very focused on how helping the PAs or the doctors understand through the lab testing, through the medical laboratory science program, how we should best come at treating a particular disease, and what is truly going on with the patient. And at the same time, then when we're talking about rehabbing patients, when we get past what the initial diagnosis is and what the treatment plan ought to be, and then all the other mechanisms that come into play in that, in terms of whether you have a speech language pathologist on the team that's needing to help somebody restore their ability to speak or to swallow. And then those managers who are working behind the scenes in the clinics themselves and making sure that we're reaching our patients and developing clinical settings that are culturally competent, so our patients feel welcome when they come past the threshold, and getting to combine those things. But Casey, you're in charge of our exploratory major. So talk a little bit about exploratory and health sciences and what students can experience in that particular area.
Yeah, sure. So I advise students during the first year in our exploratory studies in health sciences. And during that first year, we'll engage in a variety of experiences and personal assessments. I help to co-teach a course with a couple of our faculty members called Survey of Health Professions, where we'll hear from a variety of people in a host of health professions, but we also unpack your own personal values, interests, personality, and skills and strengths in order to really understand where your best fit and where your best impact is in healthcare. Because everything that Emily and Toya, Savannah has shared tonight, they've had a purposeful experience. And so with exploratory, we want you to find the best fit major, the best fit involvement that works for you. Because there's not one specific major in most cases. I mean, if you're in nursing or you're in speech language pathology, there is a specific major. But if you're not in one of those areas, there are a lot of different options. And so you have to choose what's right for you. UK as a whole, but even the College of Health Sciences is sort of this buffet. I'm a foodie, so I like to use that that metaphor. But you can't eat the whole buffet; it's not appropriate. But you build a plate that's for you. You choose a major that's going to work for your pathway and that you are passionate about. You choose involvement, whether that's research or studying at a different institution, or going abroad, or being in the pre-PT club, or whatever those bucket list items are that you want to check off, and we help you build that list and that set of goals. So if you're pre-PA, human health sciences is an option, but there's also things like biology or public health, or I tell students all the time, one of our best students that we just graduated from the physical therapy program was a finance major as an undergraduate, and I used to advise business students, and he was my student when I advised business students, and then he graduated from our physical therapy program. So you can really be a lot of different majors and be successful in a lot of the health professions. So if you have a chance, go on our website, look at those curricular options, look at those courses, and really make sure that you're making a fit that works for you, and that it's a major you're going to be truly passionate about, like Emily, Toya, and Savannah have shared.
Yeah, I think going along that, it's just like what's best fit for you. If you really like biology and you really like chemistry, go for it. I really like learning about things in healthcare. So it's about what you feel is the best for you.
So unfortunately, our time is coming to an end, but we're so glad that many of you were able to join us this evening. And we hope that you found this information both helpful and useful, and you're starting to get excited about coming to the College of Health Sciences. And as a member of our Wildcat family, and I do think it is truly a Wildcat family, we embrace each other from both within our college and within the greater Wildcat community. And at this time, we're going to continue to answer questions in the chat feature, should you have some. And then, however, if you have questions after our YouTube Live ends, please feel free to comment on this video, and we'll respond to those questions in a timely manner. In the video description, you can also find contact information, and in case you want to email us additional questions. There's also a survey that we hope that you'll fill out to provide some feedback for us this evening. And we thank you again for joining us, and thank you Emily and Toya and Savannah and Casey for being a part of this program this evening. And go Big Blue!